Hi, I'm Dr. Angela D'Alessandro, and we're going to talk today about our interdisciplinary spasticity clinic. I'm a pediatric physiatrist who's been treating children with cerebral palsy and spasticity for over 20 years. We have some questions from the community that I would like to answer today. And our first question is, why is it important that your spasticity clinic is interdisciplinary? This is a great question, and this is what makes our spasticity clinic unique in the way that we have all the different specialties of physician, as well as physical therapy and an orthotist and a durable medical equipment provider see patients together and come up with a treatment plan. We have a pediatric neurologist, a pediatric neurosurgeon, 2 pediatric orthopedic doctors, myself, a pediatric physiatrist, a pediatric physical therapist, and like I said, an orthotist and a durable medical equipment provider that come up with a treatment plan that is best for the patient, because spasticity can be very complicated and can affect patients in different ways, whether it is affecting them in terms of comfort or range of motion or mobility or ability to care for themselves. We want to make sure we determine what the patient and family's goals are that we want to treat, because sometimes spasticity can help us. Sometimes spasticity is something that in a transfer, having a little stiffness in your legs might help you move from your wheelchair to the bed. So we have to keep that in mind as well, as exactly what our goals in and why and when we're treating that spasticity. I offer things like botulinum toxin injections, which we put via ultrasound into spastic muscles to relax them, to increase range of motion and comfort and active movement. Next question, how does the patient get into your interdisciplinary spasticity clinic? Our clinic is housed at the Kireker Center for Child Development at 140 East Ridgewood Avenue in Paramus, New Jersey. In our center, we have therapists as well as different physicians, and we see the patients together. We do take referrals from physicians in the community as well, and our different doctors that are in the spasticity clinics will sometimes direct refer into the clinic as well as our therapists. How does the team choose their candidate for intervention? That can be very complicated, and that's why we have the different disciplines of physician and therapist all coming from our perspective to say how the patient should be best treated. All of our training in cerebral palsy and spasticity is not exactly the same, and that's why we have to keep in mind what the patient and family goals are. Choosing the interventions could be anything from increasing physical or occupational or speech therapy to a new orthotic or brace, to an injection with botulinum toxin or an oral medication such as baclofen or Valium or tizanidine, which are all medications that treat spasticity, or moving up to our surgical interventions like orthopedic surgery, where the orthopedic surgeons are releasing tendons or realigning bones and muscles, or our neurosurgical interventions where we are doing selective dorsal rhizotomies and intrathecal baclofen pumps that target spasticity at the neurological system. Thank you for listening today, and if you have any other concerns or want information, you can call the office or go to valleyhealth.com.